Neuropharmacology and psychopharmacology are central pillars of modern pharmaceutical science, focusing on how drugs interact with the nervous system. Neuropharmacology broadly examines how compounds affect neurons, synapses, and neural circuits within the central and peripheral nervous systems. On the other hand, psychopharmacology specifically addresses medications that alter mood, cognition, perception, and behavior in the treatment of psychiatric disorders. Together, these fields translate advances in neuroscience into therapeutic interventions for conditions such as depression, anxiety, schizophrenia, epilepsy, and neurodegenerative diseases. In the pharmaceutical space, this involves drug discovery, target identification, clinical testing, and optimization of safety and efficacy profiles. This set of protocols is often guided by an increasingly detailed understanding of brain chemistry and circuitry. Most neuro and psychopharmacological agents exert their effects by modulating neurotransmitter systems. The most affected neurotransmitters include serotonin, dopamine, norepinephrine, gamma-aminobutyric acid GABA, and glutamate. These neurotransmitters operate within specific brain regions and networks that govern emotion, cognition, and motor control. For example, antidepressants such as selective serotonin reuptake inhibitors, or SSRIs, primarily affect the prefrontal cortex and limbic system. Within the limbic system, this includes the amygdala and hippocampus, which are involved in mood regulation and emotional processing. Antipsychotic medications target dopamine pathways, especially in the mesolimbic and mesocortical systems. These pathways connect the midbrain, including the ventral tegmental area, to regions of the frontal and temporal lobes. Neurotransmitters work together in complex networks, not in isolation. Balance between excitatory, like glutamate, and inhibitory, like GABA, signaling is critical for normal brain function. Disruptions in these systems are linked to conditions such as depression, anxiety, Parkinson's disease, and epilepsy. Psychopharmacological and neurological drugs primarily work by modulating neurotransmitters. Neurotransmitters are the brain's chemical messengers. They alter the neuronal internetwork communication center. These medications increase, decrease, or mimic neurotransmitter activity at the synapse to alleviate symptoms. Dopamine antagonists reduce excessive dopamine activity in conditions like schizophrenia. They act as agonists or antagonists on neurotransmitter receptors to treat conditions like depression, anxiety, and schizophrenia. Serotonin reuptake inhibitors, or SSRIs, increase available serotonin to boost or improve mood. GABA agents. They increase GABA activity to induce calmness and reduce anxiety. Monoamine oxidase inhibitors, or MAOIs, increase levels of serotonin and norepinephrine. Here is a summarized discussion of the major neurotransmitters in the brain.
Neurons control thoughts, emotions, movement, and behavior, and they are essential for normal brain function.
What are neurotransmitters? They are chemical messengers of the brain, and they transmit signals between neurons. Glutamate is the primary excitatory neurotransmitter, essential for learning and memory. It is widely distributed throughout the cerebral cortex, hippocampus, and thalamus. Gamma-aminobutyric acid, or GABA, functions as the main inhibitory neurotransmitter. It reduces neuronal excitability and promotes calmness and sleep. Dopamine regulates movement, motivation, reward, and pleasure. It's produced in the substantia nigra and ventral tegmental area and projects to the basal ganglia, limbic system, and prefrontal cortex. Serotonin influences mood, sleep, appetite, and emotional regulation. Serotonin originates in the RAF nuclei of the brainstem, projects widely to the cortex, limbic system, and spinal cord. Norepinephrine, or noradrenaline, controls alertness, attention, stress response, and arousal. It is produced in the locus coeruleus and distributed to the cortex, hippocampus, and cerebellum. Acetylcholine, or ACH, is involved in learning, memory, attention, and muscle activation. It is found in the basal forebrain, brainstem, and neuromuscular junctions and projects to the hippocampus and cortex. Endorphins produce natural pain relief and feelings of pleasure or euphoria. They are produced in the hypothalamus and pituitary gland and act throughout the brain and spinal cord. Substance P transmits pain signals and is involved in inflammation. It is found in the spinal cord, brainstem, and sensory pathways. Histamine regulates wakefulness, attention, and immune responses. It is produced in the hypothalamus or tuberomammillary nucleus and projects widely across the brain. Glycine is an inhibitory neurotransmitter, especially in motor and sensory pathways. It lives primarily in the spinal cord, brainstem, and retina.
Additionally, emerging therapies in the pharmaceutical space are increasingly focused on neuroinflammation. They are also focused on synaptic plasticity and neuroprotection by targeting glial cells and molecular pathways. As the pharmaceutical industry continues to evolve, there is a growing emphasis on developing drugs that not only alleviate symptoms, but also address underlying pathophysiological mechanisms to influence brain function, behavior, and neurological health. This integration of neuroscience and pharmacology holds significant promise for improving outcomes, ultimately enhancing quality of life across diverse populations. Overall, neuro and psychopharmacology demonstrate how targeted chemical interventions can modulate specific brain regions. This is done by molecularly modifying the brain's neural network in order to treat complex psychiatric disorders. Advances in imaging, genomics, and computational modeling are enabling more precise mapping of drug effects across the brain. This overall approach paves the way for personalized medicinal therapies. And if you enjoyed this video, please consider giving it a like.